In the remote region of northern Uganda, women and children face an unseen peril. According to the UNFPA, about 6,000 women and adolescent girls die every year from preventable causes related to pregnancy and childbirth. For every woman or girl who dies, an estimated 20 or 30 suffer injuries, infections, or lifelong disabilities, including obstetric fistula. Babies and children are also affected by the lack of maternal health care. According to UNICEF, almost 100 babies will die each day before reaching their first month of life.
Te-Kworo Foundation works with the most vulnerable people within northern Uganda, people who don't have access to medical services. Te-Kworo Medical Center serves a huge part of the population, and is one of the biggest medical facilities within the district. And it is helping the communities get the medical services that they need and that they require. We work with pregnant women who have to walk miles to get services.
The aim of this clinic is to help the mothers to reduce mortality in mothers, and also children 5 years and below. We are aiming at also reducing mortality among children. So most of our services are concentrated on the mothers. For example, we have the antenatal care, where mothers at least have to attend about 8 antenatal care. So we offer it on a regular basis, on free of charges.
It has been very, very helpful and it's spot on for many women who would walk to come straight to the center freely, and also those who cannot come freely, we are able to provide ambulance services whereby we can pick them from the nearby homes. And I feel that this center is still very, very important, because most women who come to our center, they're really vulnerable. Most of them are malnutrition, they're anemic, so they require special treatment.
There are mothers who are in poor settings. So you find when they come in labor when they're not prepared, you get a mother has come totally the way she is. So it's you, the midwife, to fidget around and see how best you can give a safe delivery to this mother. Yeah.
Some of them, they deliver normally, but because of some abnormalities and complications of deliveries, those ones we cannot handle here. We normally have a referral system where we have the ambulance. We use the ambulance to refer them to the referral site. Only that the challenges is, beginning of this project, there were some equipment that were procured to help the running of the facility, but over time some of them broke down, others were being maintained. So at the moment we have some equipment, but there are some which we really need to replace because they have already worked for a long time. Some of them cannot now be repaired because the cost of repair is almost equivalent to the cost of procuring a new one.
Especially the delivery sets, we do not have enough, basing on the mind that our number of deliveries are increasing on a daily basis. So the sets we have, first of all, they are wearing out. Since the facility started, we have not had any new purchase.
So if we have those one which needs really replacement, that would be helpful. It will help us to improve on the services at the facility here.
The clinic is a lifeline for women and children in northern Uganda. It provides them with the care they need when they need it most. However, due to an inflation in costs and a greater demand on our services, the clinic is facing a funding shortfall. It is vital we keep this service available as we work towards building the new maternity hospital that is due to open in 2025. Without these services, there would be a devastating gap for the women and children in this region. It could mean that women would have to give birth in unsafe conditions, and that many mothers and babies would not be able to access the life-saving services and treatments that this clinic provides. Together we can all help to ensure the clinic remains open and operating so that women and children in northern Uganda have access to the healthcare they need when they need it most.
On behalf of Te-Kworo Foundation Uganda and the women of northern Uganda, we are really so grateful and humbled for your continued support and commitment in ensuring safe birth for unborn babies and their vulnerable mothers. And my humble appeal is for your continued support, your continued commitment and financial commitment to ensure that the operational is working. We're paying the nurses, paying the midwife, the medical doctor, and of course the essential drugs for most women. But thank you so much, and we wish you the best and good luck in all that you do. May God bless you abundantly.